Well, robotic surgery is the newest minimally invasive technique for doing complicated surgeries. And robotic is actually a misnomer because the term robotic tends to scare the patients. Now, what it is surgeons using very efficient robotic equipment to perform complicated surgeries.
So it's really revolutionized the way that we do this surgery. We used to have patients on our service, we used to have many patients in the hospital that we would round on in the morning. Now, we don't round on as many patients. They're gone. They've left the hospital. They're home and well on their way to recovery. So it's really changed the way that we do the surgery for patients. It's changed the way that the patients feel about surgery as well, and the ways in which they recover afterwards. That also has a significant impact on patients' mental and psychological well-being. So, in many ways, this has really benefited people.
We've been able to perform more minimally invasive surgeries using the Vinci system. It's allowed us to increase the volume and numbers of laparoscopic cases, expand the type of cases that we can do, and patients have tolerated it very well, able to go home either the same day or the next day from these previously very complex procedures.
But there are still some areas in which the limitations of laparoscopic surgery, which is the conventional minimally invasive technique, lead us to sort of a glass ceiling, if you will. And what really led me to robotic surgery is that I found that now I could start to do things that would commonly be easy as an open operation or impossible as a laparoscopic procedure, basically, suddenly be able to get done with the small incisions that people prefer, and also which help them to get home faster and leave the hospital feeling better.
When we're talking about robotic surgery, for me as the physician, it gives me two key advantages. One is a three-dimensional view, which is superior to my naked eye. And secondly, the instrumentation allows me the dexterity to get to places and do things that I couldn't do otherwise. For a patient, this means usually a safer procedure, procedures that can be done robotically that couldn't be done otherwise in other ways without a large incision, and therefore she can get home quicker, recover quicker, and get back to a normal life quicker.
This team here is just extraordinarily dedicated. The cases go very well because of the team. So it's not just surgeon, but it is indeed a team approach. So I think there's just so many advantages of robotic surgery.
When we decided to embark at Somerset Medical Center and working with our physicians on the robotic program, it was essential that our nurses also get training. And so a lot of time was spent by our nurses going out to organizations where the training sites were, and therefore they could gain great knowledge and skill. Our nurses now have gained a great deal of experience with the cases that we've done in multidisciplinary fashion. They can now do cases in urology and gynecology, general surgery, and that has been very beneficial for our doctors, but most importantly for our patients as well.
I stayed overnight just for them to keep an eye on me, and I was ready to get home at 8 o'clock the next morning, and they released me at 10 o'clock. I mean, that's how great. I mean, 5 little incisions, and I was ready. I mean, wide awake, alert. It was so simple, and recovery was incredible.
Well, I came twofold. Basically, I had a tumor next to my kidney, and I have another procedure I have to go through in maybe another month, and that's prostate cancer. And I was told about the Vinci system, the robotic. And that's the one I choose because of the less invasive and everything, and I made the right choice. I was back home the next day, and basically, I've been, every day was, it was no pain whatsoever. I didn't go through any pain at all. And that would shock me. Now, you know I want the robotic now for, my prostate. So I wouldn't recommend anything else but that.